Hello and welcome to another edition of Health Matters.
And Health Focus. I'm Ava San Marco.
And I'm Anna Marie Sinatra from Sinatra Solutions. And I just want to thank you for sending your emails and giving me phone calls and messages on Facebook, because I get really excited when I hear from you that you've been watching this show, that you're gaining some wonderful information that's helping you to make a difference in your life. And if you think you know that someone or that you'd like to be on the show, please make sure that you contact us.
Yes, email us with any questions or comments also. They're always welcome.
That's right.
That's right.
And we want to thank our sponsors, too. You know, this program is being brought to you by
Dr. Frank Mascaro
from Western New York MRI, Kenton MRI, Lockport MRI. He also has his diagnostic imaging equipment at Breast Health and at Urban Family Practice, where we are today. And, you know, I just want to say that he's like an unseen hero in our community, because he's committed to bringing you the best diagnostic imaging equipment. You know, I often tell that story where my doctor from way out in the South Town sent me to Western New York MRI to get my MRI and CAT scans done, because they're undoubtedly the best in the area. So we really appreciate him and sponsoring this show to help bring you these wonderful shows and all this great information.
Exactly. He is Dr. Frank Mascaro. They say a diamond in the rough. Yes.
Nice. And Dr.
Bennett. Yes, Dr. Bennett. He's in North Tonawanda. He's a holistic practitioner. He offers a variety of services, alternative medicine.
Yep. Alternative, they call it alternative. Now we're trying to call it complementary too. And it's Bennett Health and Wellness, and he is also one of our corporate sponsors. We're seeing quite a few shows coming from his location, because he has so many wonderful things to offer if you're out in the North Towns.
Right, exactly. And a lot of people in the North Towns may not know where to go or what doctor to select. Bennett Health is the place to go.
And I have to tell you, they're very excited, because they tell us how many people have been calling them and saying that they see him on the show. So thank you for remembering to let him know that you saw his information, his place on Health Matters and
Health Focus.
And we want to thank Kim from Mr. Frank's Day Spa, where she's doing her best to try to keep me, I want to say, beautiful or looking pretty good.
Oh, she's doing fine. I think you're doing fine, Kim.
Okay. Thank you, Kim. We appreciate all that you do there. She's expanding as well, and has, I think, a reflexologist coming in, a massage therapist, and they have, they bring their color in from Italy, and she just did this wonderful seminar where some famous Italian guy came from Italy and showed them the latest trends in haircuts and coloring techniques.
Wow, that's great. Where are they located?
The information's at the bottom of the screen, so make sure you give her a call and let her know that you heard about her on this show. Great. So let's go on back and find Dr. Frank and our other doctor as well.
Okay, come with us. We're back now at Urban Family Practice. Guess who's here? Dr. Frank Mascaro.
Hello, Dr. Mascaro, and thank you for joining us today. We so appreciate you.
Anne-Marie, Ava, it's always a pleasure to be back with both of you on Health Matters and Health Focus here today.
Yeah, well, we're talking about you on every show, and people let us know how much they appreciate you, and we appreciate you because you are in part responsible for the community getting all these great shows and all this great information.
Well, it's our pleasure. I think an informed patient is a better patient for all of us, so we want to provide the best health care for all our patients community-wide. So I think it's important for us to get out into the public eye and tell them what is offered for our patients.
Absolutely, and we've been talking too about future shows of a roundtable discussion with some of these healthcare initiatives that are going to be changing and different things.
Absolutely, I think that's very important with the way healthcare is moving into the future. I mean, not only do the physicians need to be educated on how things are moving, but also the patients. They are the consumers of this vast enterprise called healthcare in the United States.
Absolutely. Ava, did you have a specific question for Dr. Frank Mascaro, who's with us today?
Yes, I was wondering, do you do mammograms at the Lockport MRI?
Right now, we do our breast MRIs downtown at Western New York MRI. We are doing some great updating at Lockport MRI in the very near future, where you can get breast MRI performed there. But mammograms are all performed at our Western New York Breast Health Center on Sheridan Drive. It's very convenient. It's right off the 290. Easy access from Lockport and the northern suburbs, as well as the southern suburbs and everything in the city also. So it's quite easy and accessible for everybody in Western New York.
And if you missed that show, you might want to drop us an email to let us know you want to see it again, too, because I remember we were there. It was a beautiful facility. Beautiful.
Absolutely. We try to make it as comfortable and as serene as possible for our patients, because people do get anxious, when they go in for an examination, and you don't want people to get upset or anxious before an exam. So we try to make it a very comfortable place for people to be at and have a great experience at one of our centers.
And you also have your diagnostic imaging equipment, state-of-the-art diagnostic imaging equipment right here at Urban Family Practice.
Yes, here at Urban Family Practice, we provide ultrasound as well as plain film radiography for patients here. And then if they need anything more, Western New York MRI is just around the corner. It's not far from here. And Urban Family Practice offers free shuttle service as well as Western New York. So you always have a ride to either site. It's a very great opportunity for patients to get transportation that don't have transportation.
And tell us a little bit about Dr. Vazques, who we're going to be introducing to you in just a couple of minutes.
Well, this is a real treat for our viewers here today. You're going to meet, in my estimation, but I think most people will agree with me, that Dr. Vazques has built the most technologically advanced primary care center in Western New York, and I would put him up against most people in New York State and pretty much in the country. He has a very good system here. It's very educational for patients. It's bilingual. They speak Spanish here, so it helps some of the patients that are Hispanic. And it's a great place, full service, and he's just a wonderful, wonderful man that has a great vision about healthcare as well as healthcare in the future.
I'm really excited to be talking to him in just a few minutes. And what's so exciting about this facility is you want to keep in mind this is an urgent care facility, which we're always trying to educate on the importance when you're sick. If it's not life or death, you do not want to run to the emergency room. So you want to know where your urgent care facilities are and utilize these facilities.
Absolutely. Again, Dr. Vazques is a leader in the community in providing urgent care right here in his practice. And again, we're here along with him, providing X-ray as well as ultrasound. And together, our relationship spans over 10 years with Dr. Vazques.
Well, thanks again, Dr. Frank, for your continued support. And let's go find Dr. Vazques.
We found Dr. Vazques busy in his conference room. And as I'm looking around the room, I see a lot of newspaper articles. We have Business First and Medical Economics and the American Medical Association.
Yes, lots of awards and accolades here. Welcome, Dr. Vazques. Thank you so much for allowing us to come in and show the community this wonderful urgent care facility.
Well, thank you for having me.
Absolutely. So tell us, how did you get here?
Well, we started back in 1996, and at that time, I went through a lot of training, and I always wanted to serve a certain area of Buffalo, which is the city of Buffalo, which has always been dear to my heart. And I know that there's often a lot of services in the suburbs, but not in the inner city. So we opened up private practice back then, and we were trying to learn from the community as to what services were more important. So we started bringing different specialists in and providing a lot of primary care services. And after doing that for 6 to 7 years, we expanded here. And so we built this building back in 2003. And as a result of that, we constantly been sort of changing what the community needs. We were lucky to meet Western New York MRI and kindly work with them in the last 10 years. And they've often moved their X-ray services here. So we're able to at least have access for patients having access for X-rays and ultrasounds while they're here. And then if they needed any more specific tests, we were able to just get them to their different sites that they have available.
Yeah, Dr. Frank said that you have a free shuttle back and forth, and you also have, I was reading your article, free shuttle for people when they need to come here for medical care.
And we found that in order to cut down on the no-show rates, it was a lot easier to have these patients brought in. And it's the service we provided. We were featured in AMA because a lot of practices were thinking about it, but they didn't know how to go about it. One of the things that I found that was real important was, so we were providing care at a certain time. So from 8 to 5, but patients often needed care after hours. And we talked to Western New York MRI, and they also became partners in terms of this Westside Urgent Care. So we want to be able to provide a sort of full scope of service for the patient so that at least they have access to. So if they come here to the Westside Urgent Care, and it could be, you're looking at their data from their regular chart, so you're not kind of lost in the system. So it's a cure for the emergency room.
That's really, I hope you heard that, a cure for the emergency room, because it's so important today that people realize that going to the emergency room for a non-life threatening illness is not the place to go. We want to loosen up. Now they get so backed up and come to urgent care facilities. And if you're driving, you are right on Niagara Street, just off of the 190, the Niagara Street exit.
Yeah, so what we've done here, which is a little bit different than other parts, is that we truly integrated electronic records early on. So we've been doing that for the last 14, 15 years. And we use computers to kind of help with management. So it kind of helps. It's still difficult in terms of time. I mean, so we're not going to get people through the system fast. As we're trying to do the best we can. But the way the system still exists around us is we're moving as fast as we can. But we're able to really track down on what patients come in with. So we're using computers. If you're a male 65-year-old smoker, you need an evaluation for an abdominal ultrasound to avoid a big artery that can rupture and you'll die. So this is something that's part of standard of care, but computers help us pick patients out within the patients that we're treating, and it just helps overall to manage the patient. We're also giving patients in the medical, because we're a medical home, so we were able to get an NCQA level 3, which you have to submit and do a whole lot of things to be able to get that level of credentialing. But what it allows is the patient's able to use the patient portal too. So they're able to come in, schedule appointments, look at triage, look at labs, take documents. So they're part of the process, as opposed to in the past where they come in and they don't know what's going on within that system.
I think Ava's got a question. I see it brewing.
Okay. What area do you serve? Mainly the Lower West Side, would you say?
Yeah, the Lower West Side is where, mostly. But I get patients from all over. I got patients in Jamestown, Dunker, Puerto Rico, New York City. So we do have patients that once they're here, they still come back.
Yeah, I can see why. So for those who are watching now, if you don't have a primary doctor, or even if you do, you may want to call Dr. Vazques, call the office, the number that you're seeing at the bottom of the screen, and schedule an appointment, because I would imagine that it would be a good idea before you're in an urgent care situation to come and get a physical and get yourself in the system, so then when you do have an urgent situation, you already know the people.
Well, the other thing is in primary care, we're focused on picking up other diseases. And diabetes, as you know, is a major problem, asthma, hypertension, depression. We as primary care manage those patients. And so if you're coming into a facility like us, we're going to make sure that the proper chronic disease management is taking place. So we're covering the preventive stuff. So making sure you get your mammograms, that you get your colonoscopies, that you get your standard bloods, that if you're a male, you're getting your prostate exams. So there's a lot of pieces that come into the equation, but we're trying to, within the office, provide the best possible services.
Yeah, I really enjoy hearing you talk about that, because once again, it's what we're always telling you. You have to be proactive with your health care. You have to get those tests. And no, nobody likes to do them. We much rather, have an ice cream cone and go down by the water and look at the water, but that's just not reality. We're grown adults. We've got to get proactive and take the tests and do the work that we need to do to get diagnosed, so that we know what to do to get better health.
And I think that's the bottom line. So, hopefully the model that we're developing and integrating is actually preparing for future healthcare reform, where they're looking at providers managing the actual care. of patient as opposed to hospitals and managed care markets. And with these systems that we've actually put together, and Western New York also, we're able to kind of create a RIO, or communication, so that if patients go to hospitals or x-ray systems, that information flows seamless into the EMR. So the electronic record, let's say you saw a specialist at the hospital, that information will come in, and I could just tag it into your record and know what follow-up, as opposed to now, when you go there, no one really knows where that is, and you're waiting for faxes to come back. So all this stuff is tying in more and more. And in Buffalo, New York, we're actually doing a very good job. So not just my practice, other practices that are doing similar type of innovative approaches to managing patients.
Yeah, and you're also a diamond in the rough. The more I hear you speak as we talk about Dr. Frank Mascaro, is that you have this advanced electronic system. I'm out of my those initials again. You'll have to tell us more about that for that part of it, and then as well as having such a beautiful, awesome facility right here, almost in the heart of downtown, for people to come to get some really great care.
Well, one of the other things that we did was we looked at the data that comes in terms of patients. And what we've done is basically created services around the diseases that we have. So since we deal with a lot of diabetes, we have a podiatrist, we have ophthalmology, and also heart. We deal with a lot of asthma, we have an allergist. We deal with a lot of musculoskeletal problems, so we have physical therapy and rehab. You're trying to learn from the markets that you're treating. As a primary care physician, we do a lot of things here. In addition to stress tests, T waves, a lot of tests that patients would have to go elsewhere. We find that just providing them under one roof, it's sort of the Wilson Farms approach to care medicine.
Oh, that's amazing.
So you have a specialty, your own specialty, and subspecialties, so to speak, in your office. In other words, you have podiatry, allergy, right? That's great, because so the patients don't have to go elsewhere, like you say. And when it's hard too, like with the diabetes, because then you have a podiatrist on site. He can go for a foot examination right there at that point.
We're also with the urgent care. Because we moved in that level, we have an operational lab, so that certain chemistries can be done. So if a patient comes in with belly pain, we can order belly labs, give them IV fluids, get x-rays, and see if that patient requires the next level of care. Yeah. Well,
I think this is the future of our medicine. I mean, think about it. When you have to go to one place, your primary doctor, and then you have to go to 3 other places to get the services that you need, and you don't have to do that here, because this is an urgent care facility as well as regular well visits.
And the two are talking to each other. So we're doing what they call health information exchange, where the data from one moves to the other. So you're not losing care. So if they come in, we had a patient today that came in complaining of belly pain, is a new onset diabetic. That's already, she gets put on a medication. This is not the medical part of it, but that information gets transferred over to the primary care. So when she comes in for follow-up, where at least the loop gets closed, and you're not duplicating services. Oftentimes you go see the doctor, labs, x-rays, and things were ordered, and you see the provider, you focus on another issue, you leave. By the way, I forgot. And these things we're trying to close the loop, because they create a lot of callbacks and a lot of it breaks down the system that we're trying to provide.
That is great, sure, because even with myself, once you leave the office, you might forget. I mean, I do have my tests done, but it does close the loop if they're on site, because, out of sight, out of mind, and it's right there in front of you.
I know. I get busy, and then I don't go do what I'm supposed to do, and a year passes, and I still haven't had the test I was supposed to have.
Right, and the patient portal also closes the loop, because if you have a lab test, I can leave information for you, and you can just come in and check it. You become part of the process, as opposed to trying to find the patient and send letters and calls, which is a routine that we presently follow. So it's creating more of a partnership, and I think that hopefully will be where healthcare finally develops.
Yeah, I love it. That's what we're talking about, proactive all the time, getting proactive. So what about some things that people can, besides calling you and making an appointment, what can they do to, be more aware of their health? What kind of things should they watch for? When should they know whether to call you, whether or not, when it's important to come in?
Well, it's interesting enough. I have a website. You can go to my website, which is www.urbanfamilypractice.com, or the urgent care, which is www.urgentcare.com. www.westsideurgentcareplc.com, and they'll be listed on the bottom. I think clicking either one of those, go to the PubMed Clinical or Health links, and there you go down with what's called Medicus and Medlines, and you can get so much a wealth of information just from a link. So let's say if you have diabetes, you want to learn more about it, you click and there's a whole description on it and patient instructions on it. So, and it's very simple and in different languages too. So we've tied in. There's just so much wealth of information out there. Sometimes it gets too much for patients. What we try to with the website is to bring it in. We have our Facebook connection, we have our Twitter connections there, more to get patients information, not to talk in terms of a social, but if something develops where there's a big problem of vitamin D deficiency now in Buffalo because of the sun exposure that leads to depression and a lot of other things that needs to be corrected. And so you see articles on that, you can distribute that information among these social networks. Tweeting the same thing. If something remarkable happened, you tweet it to people. So there's that way that we can communicate with people. And I think the more we do this, the better the patients are going to get more information. And we also have a doctor's blog there that ties in everything we've actually done, any news coverage, anything that we've done here in the practice, the change of practice. You can just go down and you'll see the history since we opened. So it's these sites are becoming more and more of an open book so that people know who their providers are. In addition to, if you go to one of the links about us, which has information about the NCQA, the National Quality Committee and Quality Assurance, that'll talk about level 3 and what we were able to achieve. So you can see that there. And on the bottom, you click and you'll see a CV, and you'll see my whole CV as to what my background is, a resume. And I think the more you know about your provider, the better it's going to be. But so we've tried to use some of the media to be able to get some information out to patients, which I think it's hard to know where to start, and it's worked out pretty well.
Wow, that's a lot of information. That is absolutely incredible. This is so exciting. Yeah, you got to get on that website, do some clicking, do some surfing, and get some information, get proactive. You spoke about the deficiency in vitamin D, and that's it really is very prominent here in Western New York. So if you're wondering why you're depressed, you might want to come and see Dr. Vazques and make an appointment and get these levels tested. I'm wondering if you want to take us in one of your other rooms and show us one of the examining rooms, and we'll take it from there.
Sure.
Awesome.
Here we are with Dr. Vazques in one of the examining rooms. She's going to show us the Media Center, how to educate patients through the media.
And here we go. Take us through this, doctor.
All right, so what I try to do is create this sort of Disney experience where patients are often waiting for the 5 to 10 minute visit, which is often the ride. So we've learned from what patients have, and what we've developed is basically a lot of different diagnoses. So if you come in and you do have colon cancer, we can actually bring up a sort of a little mini synopsis of the anatomy, the symptoms, diagnosis, and treatments.
Wow.
So that the patient has the time to go through this, give them a printed report, and then come back and kind of close up. So, because it's often, if I have to come in and tell you have cancer, that's the last thing you're going to listen to. So at least here, you're going to be able to learn what's going on without me in the room, then come back and actually go over what I expect them to know. I think it's real important for us to use this type of approach because we're often, it's a better approach because they've actually concisely done everything so that you're aware of what's new in terms of treatment, but also diagnosis, and you'll know just as much as the doctor coming in.
This is just wonderful, because how many times do you go to the doctors and you're sitting in a room and you have to wait and you just get really nervous and you're sitting there with some silly magazine, where now you can have the option of really learning about what's going on in your body.
And we have the same linkages on the website, so you'll be able to see the same kind of presentations for multiple different diseases.
So when they come here, they could do it here and then talk to you directly. When they go home, they could rewatch it again.
Yes. Yes.
Wonderful. Did you want to navigate a little bit more and show us some of the other stuff?
Yeah, so I mean, we have, you give them the options to do that. There's also procedures or testing that they may have to go, or prevention that they may have. So if it's cholesterol management, preventing stress, smoking cessation, you can easily just click through the whole process and you get descriptions on everything. But some patients just like to, they want to get away from things, so it's a nice way that we can just put the television on and they can also watch television.
Oh, wow, how nice. We don't want them to watch TV, though. We want them to learn some facts.
Right. But you try to do what you can, but I think it's a nice way to tie up the time that the patient's here.
Yeah, that's very nice. You've spared no cost or no effort when you have just made this facility just incredible.
And it's we've been open here in this new site since 2003, and we're 2010 going to 2011. So
wow, that's a long time.
Mm-hmm. So I think again, we're trying to do the best we can. We are not perfect, but I think what we're trying to do is really provide a different level of care.
This is amazing. So now, people who aren't real computer literate, do you have some people who help tutorial through the process?
Yeah, actually, we also use that's a very good question, because, for example, we have little synopsis where I come in and explain the first visit, how to use the website, health proxies, and so I am the one that's in the video describing it to patients. So we try to give them updates, and these are things that I've put together in the past, and I think it's real important to kind of, instead of saying the same thing, at least having one central message where the patient can understand things a little bit simpler.
I absolutely love this. But I say take the TV part off. Definitely take the TV part off and make sure that they're watching these things. This is awesome, folks. And you get to go home and watch it again and again so that you really get it. You never go, when you go to the doctor's, then you get home and you go, what did he say? I forgot.
I remember, and you're reading a magazine. This is great. I love it. Don't you?
Absolutely. Yes.
So that's it. I think that we have enough technology these days to help us with a lot of different management. I think that's what we do the most.
I see your love of technology you have married with your practice, so that's wonderful. Thank you again for allowing us to help to educate the community on their options.
And thank you for having me again. And I'd like to thank Western New York MRI for making this possible too.
Absolutely, yes. Thank you. Thank you to all of our sponsors. And so now you heard it, folks. You've got the information once again, but information without action is going to leave you powerless. So get some power. You've written down those things. Call the doctor and get proactive, because your health matters.
So stay focused.